Hello everyone, my name is Kendall Garner and I am an expert in migraines with a deep personal connection to the subject, having dealt with them for the past 10 years. I work with a corporation where I focus on migraine awareness and prevention. We are dedicated to improving the lives of those affected by migraines through education, advocacy, and improving preventive strategies. By collaborating with healthcare professionals, conducting research, and engaging in public outreach, we aim to empower individuals with the knowledge and tools to better handle their condition and reduce the stigma surrounding migraines. My aim today is to share valuable insight from both my professional background and my personal experience to help those individuals who are navigating the challenges of migraines. This presentation seeks to raise awareness and provide practical strategies for prevention. By the end of our session, you will have a clear understanding of different types of migraines, effective coping techniques, and resources for further support. The goal of this lesson is to educate people aged 20 to 30 in Bartow County about migraines and prevention of migraines. Objective 1 is, by the end of the lesson, at least 90% of participants will be able to name 3 common migraine triggers. Objective number 2 is, by the end of the lesson, at least 90% of participants will be able to name 3 non-pharmaceutical strategies. Here it shows our lesson goals and objectives that we just went over. Before we get started with the lesson, we're going to start with the icebreaker. Please introduce yourselves. Now let's play 2 truths and a lie related to migraines. Each of you will share 2 statements about your personal experience with migraines and 1 false statement, and the others will have to guess which one of the statements was false. This activity will not only introduce you to each other's stories, but also set the stage for the valuable discussions and tips we will cover throughout this presentation. Starting out, we're going to go over the overview of migraines and what it is. Migraines are a type of neurological disorder characterized by recurrent episodes of severe headaches, often accompanied by other symptoms such as sensitivity to light and sound, nausea, and vomiting. Once again. On this slide, we're going to talk about how migraines are complex and debilitating that affect approximately 39% million people in the United States alone. Women being more likely to experience them than men. These episodes of severe headaches are accompanied by symptoms such as nausea and vomiting, and even oral or sensory disturbances. This condition can be highly disabling, affecting an individual's ability to work and engage in daily activities and maintain a normal quality of life. More symptoms of migraines include a headache pain, which is typically on one side of the head, throbbing or pulsating, dizziness or vertigo. The mechanisms behind migraines can be a complex interplay between genetics, brain chemistry, and environmental factors. There are many things that can trigger a migraine for me personally, but here are some common ones that you might be able to experience, or you might not. It just depends on how each person is to migraines. Stress is the biggest migraine trigger. Physical or emotional stress can trigger migraines along with certain foods. Food additives such as MSG or aspartame, processed meats, fermented foods like cheese and wine, or foods high in triamine like aged cheese or fermented meats. Migraine triggers may vary from person to person, but the common culprit include physical and emotional stress, foods, changes in sleep patterns or lack of sleep. But the main thing to remember is identifying and avoiding personal triggers is key to maintaining migraines. Migraines are relatively common in people aged 20 to 30 with this age group, often experiencing a peak in migraine prevalence. Studies suggest that migraines affect approximately 18 to 25% of women and 6 to 10% of men. This means that there is a significant proportion of young adults in their 20s and 30s experiencing migraines, making it a relevant health concern for this demographic. Now we will share personal experiences and identify at least 3 common triggers that y'all may be experiencing or that I haven't shared yet. Now we're going to look into preventative strategies for migraines. The biggest thing to prevent a migraine is lifestyle changes. Lifestyle changes include regular exercise, and it can help reduce migraine frequency and severity. Stress management, techniques such as meditation, yoga, or deep breathing exercises can help manage stress to prevent migraines. Other preventative strategies include dietary adjustments, like keeping a food journal to track your triggers, then avoiding those triggers, increasing omega-3 fatty acids, and making sure that you're aware of your acid intake. Staying hydrated is also a big key factor in preventing migraines. Non-pharmaceutical strategies include biofeedback, which is a technique that helps individuals become aware of physical responses to stress and learning to control them. These include identifying and avoiding personal triggers like certain foods, stress, and sleeping disturbances, regular sleep schedules, consistent meal times, and staying hydrated are crucial. Stress reduction techniques such as yoga, meditation, and biofeedback can also be beneficial. Additionally, regular exercise, maintaining a headache diary to track patterns and triggers, and ensuring proper posture can contribute to migraine prevention and management. More non-pharmaceutical preventive strategies include cognitive behavioral therapy, which is the type of therapy that helps individuals change negative thought patterns and behaviors that contribute to migraines. Now we will engage in group discussion and interactive activities to solidify the understanding and application of these concepts covered. We're going to do now the migraine awareness and prevention quiz. Give me 1 second. Seems my papers. The quiz will be administered online using a multiple choice format and will be completed by learners individually. Now we're going to talk about preventative strategies that are pharmaceutical. These often involve daily medications aimed at reducing migraine frequency, severity, and duration. These include beta blockers, certain antidepressants, anti-seizure medications, and CGRP inhibitors. These can all specifically target the calcitonin gene related to peptide pathology. Some pharmaceutical preventive strategies include Botox. These are injections and are also a preventative option for chronic migraines. The choice of medication depends on individual factors like type of migraine and frequency of migraine, coexisting conditions, and potential side effects, and is typically determined in consultation with a healthcare professional. A consult with a healthcare professional is crucial for determining the best treatment plan, which is understanding the potential risks and benefits. There can be extremely dangerous side effects linked to the preventive medicines that can cause long-term effects that you cannot get rid of. I am currently on a migraine preventative medicine that I take daily, and I've had to change it multiple times due to some side effects being more severe than others. Now we're going to do a next learning technique, and that is going to be a migraine and awareness quiz again. That will also be online, just like the other one, and will be multiple choice. One more thing before we start ending our lesson is the different types of migraines. There is sinus, there is pressure, along with different parts of your head that you could have a migraine. It all depends on. There are many different types of migraines. First one being migraines without an aura, which is the most common migraine, characterized by throbbing or pounding headache on one side of the head. It may last for hours or even days. Other symptoms may include the nausea and the vomiting. The second different type of migraine is migraine with aura, which is a classic migraine. It occurs with an aura, which is a series of neurological symptoms that precede the headache. May include visual disturbances like flashing lights, blind spots, numbness or tingling, or difficulty with speech or movement. Another type of migraine is a hemiplegic migraine. It is a rare type of migraine that causes temporary weakness or paralysis on one side of the body. It can be accompanied by an aura. Retinal migraine affects the vision in one eye, causing temporary loss of sight or blurred vision. May be accompanied by pain behind the eye. Menstrual migraine occurs around the time of a woman's menstrual cycle. Similar to other types of migraines, but may be more severe or longer lasting. And then there's also the chronic migraine, which occurs 15 or more days per month for at least 3 months. It's important to know that these are just some of common migraines. There may be at least other less common or rare types as well. It's recommended to consult a healthcare provider for proper diagnosis and to further examine your treatment options. Now let's talk about how you can get involved. Step 1 is to learn about the triggers. Keep a headache diary to identify patterns. 2, make lifestyle changes. Maintain a consistent sleep schedule, exercise regularly, and avoid known triggers. 3, seek medical advice. If you experience severe or recurrent attacks, consult a doctor immediately. Advocate for others is number 4. Learn how to advocate for children who have trouble communicating their pain. We're going to go over both quizzes that we took and see what we got right and what we got wrong and go over the answer choices. For the first quiz, the first question was, which of the following is a common trigger for migraines? A, hydration, B, stress, C, regular sleep schedule, or D, balanced diet? And the answer for number 1 is B, stress. Number 2, how many hours of sleep do most adults need to prevent migraines? A, 4 to 6, B, 6 to 8, C, 8 to 10, or D, more than 10? The correct answer is B, 6 to 8. Question number 3, which dietary habit is recommended for migraine prevention? A, skipping meals, B, eating a high sugar diet, C, maintaining regular meal times, or D, consuming excessive caffeine? The correct answer for number 3 is C, maintaining regular meal times. What role does exercise play in managing migraines? A, can trigger migraines, B, has no effect on migraines, C, helps reduce stress and tension, or D, only worsens migraines? The correct answer for number 4 is C, helps reduce stress and tension. Which of the following for number 5 is not typically recommended for migraine prevention? A, identifying personal triggers, B, overusing pain medication, C, keeping a headache diary, or D, staying hydrated? The correct answer for number 5 is overusing pain medication. Now for the second quiz that we did. The first question is, what is the primary cause of migraine headaches? A, sinus pressure, B, tension in the neck and scalp muscles, C, changes in weather, or D, all of the above? The correct answer is all of the above. Question number 2. Which of the following is an effective way to prevent migraines? A, avoid stress, B. Getting regular exercise. C. Staying hydrated. D. All of the above. The correct answer for number 2 is D. All of the above. Number 3. What is the common coping mechanism for maintaining migraine pain? A. Over-the-counter pain medication. B. Practicing relaxation techniques such as deep breathing or meditation. C. Applying cold and warm compress to the forehead. Or D. All of the above. The correct answer will be all of the above. I'm going to give you an exit question. Can someone share a key trigger that can lead to a migraine? Are there any final questions to clarify any points or provide additional resources? I would like to thank each participant here today for your commitment to migraine awareness and prevention, as your engagement and support are crucial in fostering a deeper understanding of this condition and promoting effective strategies for those affected.